which give you an online classes, and there are places which give you PLAB training for your second part. So I can share that with you in the end if you're interested. And once you pass PLAB 1, will the system allow you to book your PLAB 2. Now, because of COVID, I think it's sort of all blocked up. A lot of people have booked it, but my understanding is sometimes you have to keep an eye on the website, and the PLAB 2 is an exam which is held in UK. So if you are planning PLAB 2, you have to plan for a visa as well. The visa process is not difficult. If you have proof that this is why you are coming, you can always apply for a visa. What I recall is it costs around 8,000 rupees for the visa. And if you're going to go around the long route, visa processing times have increased considerably since COVID, but I think the usual time is 15 working days. And remember, 15 working days in UK. We don't work Saturday and Sunday if we can help it. Friday afternoon, we are all mentally switched off. So you have to count 15 working days. So you have to plan your trip so that you book it well in advance. And the usual visa, standard visitor's visa, it's called, it takes around, I think, it gives you a validity of 6 months. If you are interested, you can also attend a PLAB practical course in UK. There are a few very popular ones. I can ask and give you some names if you are interested. Okay. Okay, this is a view of my, just outside my hospital when you're walking down. You can see working in UK has been quite different. I mean, from the way we work in India. I have worked as a senior member of staff and a teaching faculty. And I had to adjust to an entire new working system just about 5 years ago. What everyone who came before me said was, don't give up for at least 1 year. And after, I think, the junior staff that I'm know, they adjusted really fast. Someone older like me takes a little longer because you're used to all the comforts of juniors and everything. But you get adjusted and you see the advantages over a period of time, okay? And you like your colleagues, you like certain things about the way you work, which I'll go into. Briefly, I'm going to just say one more thing. I mean, Ashif is going to cover the training part and everything. What I have found is you can potentially take the MRCP exam after your MBBS if you train for it. If you have maybe even 1 year experience working as in a medical specialty or a surgical specialty, potentially you don't have to wait until you have finished your MD or MS before you take your MRCS. No, in UK, it is a sort of entry level exam something you take before you finish your training, much before you finish your training. So it is worth a thought that PLAB, if you don't get seats, MRCS or MRCP is a very good option. Okay. So Ashif, should I go over the questions or do you want to go over what you're going to do? Ashif?
Hi, Sridevi. Thank you.
Yeah.
What I'll do is I'll also share my screen and do some presentation on a few other important topics. So, and then we'll come to the questions, if that's okay.
That's absolutely fine. I'm just going to switch off now. Thank you for listening. And we will go over the questions. And in the end, if you have any questions at all, I suggest you put it in the chat. And we will also share some links in the end for those who are interested. Okay, thank you.
Thank you, ma'am.
Yeah, I'm just going to stop sharing my screen.
So next, as our next speaker, we have Dr. Mohammed Ashif, PA. After completing his MBBS and MD in General Medicine from Calicut University, he he currently works as a consultant endocrinologist from 2017 in Canada. He has many achievements to his name. He is a member of the Royal College of Physicians, Royal Colleges UK, MRCP Endocrinology, Royal Colleges UK, CCT UK Endocrinology and Internal Medicine from Royal Colleges UK, Cambridge University Hospitals UK, Ontario, and Alberta Health Services. So now we'll have Sir talking. Thank you, sir.
Thank you very much for inviting us for the meeting. So as Sridevi mentioned briefly, so we belong to the same batch. That's why I call her Sridevi. Dr. Sridevi. So we belong to 19th batch of our college. So this is an attempt to give our pathway and experience of what we've actually gone through years. I mean, at one point when we decided to come out of India and do postgraduate training programs, it was so difficult to get information. So getting information is the key for us to succeed. Actually, it's not that easy to get information. But nowadays, with the social media, it's so easy for you to get into YouTube and get information from people who have already gone through the process. But even then, so if you have a pathway in mind, you have to start from the scratch, find out what other people have actually gone through. So it'd be very useful for the peers and the seniors from your college to go through this, which we have gone through, for us to share that information with you. I'll share a screen, prepared a few slides, just like what Sridevi's done. Let me do this now. Give me a minute. You can all see my screen, isn't it?
Yes, sir.
Yep. All right. Okay. So I'll just go through a postgraduate training program. So Sridevi touched upon the most important pathway right after your MBBS, what to do to get into the program, into a different country, write PLAB, write MRCP, get registered with General Medical Council. So you get your license to practice in a different country, in the UK. And then from there, how are you going to progress your career? So that is very important. So you should know what would be the end point, or what are we targeting actually towards the end. So for that, a few things you should understand is USMLE, Canadian Licensing Exam, PLAB exam, they are not postgraduate qualifications. They are just qualifying examination so that your MBBS is recognized in a different country so that you can practice in that country. So your MBBS or our MBBS is actually not recognized in any of these countries unless you do these exams. So they are just qualifying exams. USMLE, so one might be wondering, is USMLE tougher than PLAB? So the difference between USMLE and PLAB is that PLAB is an exam where you have to just qualify. You are not, there is no grading based on PLAB, and you're not entering into a system or a training pathway based on PLAB. But the USMLE is different, and it's tougher because you have to get a score. So you have to get scored maximum in USMLE so that you get into matching. So that's the difference. Canadian licensing exam, I'll briefly touch upon Canadian licensing exam later on, but that is something very difficult to get into, but I'll touch upon that later. MRCP, MRCS, MRCP-CH, so that is child health. So, and similar MRCP membership examinations are Royal College examination, that respective specialty. Those are known as postgraduate diplomas. So they are the alternate pathway, just like Sridevi mentioned briefly, that they're alternate pathways for registering into the UK General Medical Council. So if you're not writing PLAB, if you have 1 year of experience as a doctor, you can write your MRCP. MRCP has 3 different steps you have to start. There's a part 1, which is a multiple choice question exam. Part 2, again, a multiple choice question. And part 3 is also known as a PACES exam, or clinical skill examination, where you have to actually go through 5 different stations, maybe 10 different cases, and you will be assessed by 10 different examiners to get your MRCP. But even then, it is still an entry-level qualification. That means in postgraduate training program in the UK, as we reach level 2 or level 3, what we call ST2, ST3, or ST4 level, to progress into the next level, you need this exam. So unless you have this exam, you wouldn't get into that sort of final completion of training pathway. So in here, MD and DM is clustered into a program known as CCT, or Certificate of Completion of Training pathway. For that, you have to go through something known as a higher specialty core training and higher specialist training. So once you complete the whole core training and higher specialist training, then you finish both like MD, MBBS and MD equivalent to India, and you finish your full qualification. And then you register as a consultant with the General Medical Council. So that's your ultimate aim, to finish registration with the General Medical Council as a consultant, and so that you can practice as a consultant. Till then, you'll be working as a specialist, and then you become a consultant after you finish your registration with General Medical Council. Residency and training in the US, UK, and Canada, they're different. I'm actually talking about those countries where the training pathway is very familiar to me. So UK, of course, I've gone through the training pathway in completion. Canadian training pathway is almost similar to the US pathway, where they do a residency followed by fellowship. In the UK, they do core training and higher specialist training. UK training program is generally much longer than Canadian and the US training pathway. There is a question about whether the postgraduate qualification in India is recognized in these countries. In the UK, yes, it is recognized, but there are clauses, and I mean, it's not easily recognized. You need to prove that you've actually trained in the postgraduate pathway in India. For that, you come to it. So you have to start working as a doctor, first of all, and then you have to work as a specialist doctor, get your competences recognized so that you're signed off with that competences, so that the core training, the initial part of the training, which is like internal medicine or general surgical training, can be recognized to an extent. But even then, you have to do catch-up training to complete the training in the UK to become a consultant. So Indian training is recognized in the UK, but is the postgraduate training recognized in the US and Canada? No, it is not. So PG training in no form is recognized in North America. So you have to do training from the scratch. UK specialty training pathway, I'll briefly mention about those pathways later. CCT and CCST. CCST used to be the older version, pre-2010 version of CCT. CESR is Certificate of Eligibility for Specialist Register. So the doctors who are actually trained in India, who have got their MD or DM, they can come over to the UK, they can practice in India, and eventually they can get registered into the specialist register in General Medical Council, so that they become a consultant. So this is an alternate pathway by which you become a consultant in the UK, but that pathway doesn't exist in Canada or in the US. So I'm giving you some idea about how I'm giving you some idea, but I'm putting some links in here so that I can actually view those. So I'll share my slides later on. So these links can be easily gone through. So the first thing which I've mentioned is IMT. I mentioned about core medical training, or CMT, which is converted to IMT, which is internal medicine training program in the UK. So IMT recruitment, if you go through this website, that actually gives the recruitment of IMT, and that's the initial part of the training program. I've mentioned this IMY3, which is year 3 of IMT standalone recruitment. This is for those people who've already done some training in India, completed their MD or DM, and they're coming over to get some part of the training recognized. So this can be used to enter into the middle of the training pathway. If they got MBBS, they can actually progress into the higher specialist training. And the next one is something known as, so after the IMT, you have to go for this higher specialty training pathway. So for the higher specialty training, you can actually go through this link. It actually gives information about higher specialist training in the UK and how to get into those training pathways, and also different specialities. So how to choose a specialty? I mean, if you're working in a particular specialty for some time, if you like the specialty, you can always take it. But if you don't like it, you can actually try sort of observing what the other specialist does in the other specialties, and eventually you can actually get into those specialties gradually. So that is up to each and every one of us, how we differ in our approach to our patients. You can choose a medical versus surgical specialty. You can choose an interventional specialty versus a non-interventional specialty. That's according to what your choices are. So, but for that, some observerships will definitely help, and some experience with each of these specialties will definitely help through. Core medical training is one of those avenues where you can actually go through different specialties and find out what fits for you the best. Yeah. So Canadian certification, I mentioned briefly about the UK certifications. For the PhD in the UK, so those who are interested in research, they can actually get integrated into one of the CCT programs, and eventually they can actually also get a PhD along with it. So the way they do that is actually through the CCT, you can come out of the program, do a research for about 4 years or so, get part of that training recognized for the CCT, so that the total duration of CCT actually gets down, and eventually you can also get a PhD once you qualify, and you can work as a research scientist. The same way, it's also existent in the other pathways in American board and Canadian exams, where you can actually do an associated PhD to become a scientist. Canadian RCPSC examinations. So briefly about Canadian pathway. For Canada, you have to come here and you have to have a permanent residency status in Canada for you to write exams here, so that you can get into the Canadian residency program. So it's much more difficult than the US pathway, unless you got training from the US or the UK or Australia or New Zealand, where you can actually come over here and get your qualifications recognized. But then after that recognition, you still have to go through many exams to get what we call FRCPC, or Fellowship of the Royal Colleges of Physicians and Surgeons of Canada, which is an entirely different college. It's not UK college, it's Canadian Royal Colleges. And they give certifications for all the specialties and subspecialties here. So I don't normally recommend people to come over from the scratch and start doing Canadian residency program here. Rather, it is better to get into American board examinations. Even if you're planning to come to Canada, it's better to do USMLEs, get to American board certifications, and then eventually, if you decide to come over to Canada, you can do it that way. That will be much easier. Australian, New Zealand, and Irish qualifications are also equally recognized in Canada. And most of these qualifications have something in equal, because they do have some cross recognition. That means a person with a CCT from the UK can practice in Australia and New Zealand without exams. They will have some recognition and pathways and things to be done, but still they can practice. For Canadians, they can come out to Canada with some extra exams and certifications. Canadian FRCPC holder can practice in the US in certain states, actually, with special sort of permits and qualifications. So these sort of examinations and these countries have something in common that actually unifies their postgraduate training program. For that matter, CCT and American board examinations are also recognized in India to get, so you can actually register that with your council, and you can, instead of DM or MD, you can become a specialist and subspecialist if you have these qualifications. So we had some written questions from you about, is it worth it coming over and practicing here and gaining qualifications? I think it is, actually. As long as you come here, get your qualifications done, you get eventually recognized. And if you want to even practice in India, you can very well do that. If you go back and you can register with Indian Council, you can very well practice in India. So yeah, and about Canadian pathway, I normally don't recommend it, but this is the usual pathway people follow when they're planning to get into the residency pathway. They have to get something known as a NAC, OSCE, and MCCQ exam and get a scoring based on it. And there is a matching in Canada where people get into the matching and get into the training pathway. And again, 5 years, 6 years of postgraduate training is required to finish your training. All right. Yeah, I think I've done here. Sridevi, do you want to share those questions, and so shall we go through that?
Yeah, I think, shall we go one by one? and I think I'll just read them, and I will do a few, and you can take a few. Yes, and maybe you can
of course.
add on anything when I'll just read them out. I've got a few. So the first one I think we've covered. What is PLAB? So it's also called Professional Linguistic Assessment Board Exam. I hope we are clear on that. When should I start preparing for this exam? And does this exam work similar to NEET PG? No, and yes and no, because you should start preparing, I think, or thinking about it in your final year. And you need to at least gather information, think about what you're going to do. Now, some of you might not want to take the difficult, I mean, I call it the difficult route. There are other training pathways or other pathways which are well supported by the hospital trusts. One is a sponsorship pathway. There are certain general medical council sponsors, sponsoring hospitals or trusts, which will sponsor you. So you can apply to them with just an IELTS and say, okay, this is my experience. I am interested in working in such and such a department. So the problem with this is you will have to contact these individual trusts, and they will have to get back to you. I understand that this pathway has a lot of applications coming through GMC. And the other is now it's becoming an established pathway. It's something called the Medical Training Initiative. It's called MTI. Now, MTI, there is an actual application form for it. You can just apply with your IELTS. You will have an interview, which will contain more like a clinical scenario. Now, there are certain things you have to be familiar with, certain terms you have to be familiar with if you're going to come to UK. Audit is one, medical audits, yeah? So this is not something we are familiar with in India. It is, you can think of it as mini research. You work in your, just let's say you work in your department, in your A&E or your acute medicine department, and you find a problem with the system. You ask a question, how many, say it is about documentation. You find that you're not documenting properly and no one's putting signatures. You decide, I'm going to audit all the records. I'm going to look at all the records for 1 year and see how many people are doing it. 1 year is too much, by the way. And then you go to a meeting, you publish your results, and then you say, okay, I would like everyone to at least put their name and the date and the time and sign in the end of it and document like this. And you see if there's a change in the practice. So, and you publish your results. Yeah. So this is like a very basically an audit. You will get asked about what an audit is for your interview. I think it is a sure short question for interviews. What is a clinical audit? What is clinical governance? Now, coming back to the question, I think you should start preparing in final year or start thinking about it in final year. And the practical part of the exam, I told you there are 16 stations. Now, what is covered in these stations? They're usually, you have an examiner sitting there. I think you have 8 minutes. You can read and prepare mentally for the question in 2 minutes. And then it might be breaking bad news. The patient has cancer. You're going to break bad news. Now you speak to the actor and you have to sort of, and the actor will respond to you. Calming down an aggressive patient, talking to bystanders. These are usually the stations that you encounter. There will also be stations for things like IV cannulation, taking an ABG and things like that. Okay. Now there are training programs which can train you for that. I know of one. Again, this is not an advertisement. This is just someone told me this. There is a team called the Samson, I think it's called, in Manchester. They run a 15-day training program for PLAB. Now, once the exams change, I don't know what's going to happen. How to build a CV for PLAB? Do you want to take that one, Ashif? I mean, you don't need a CV for PLAB.
I don't think you need a CV for PLAB.
You don't need a CV for
all
PLAB.
you need is register for the exam and go for the exams. Yeah, I'll add one point onto what to the audit, or what Sridevi has mentioned just briefly. Even when you're applying for a postgraduate training pathway, you have a system by which they actually take your application and they give you a pre-interview score. So for each and every pathway where you go through, enter into a training, so you still have an application. An application needs to be filled up, and that application goes into a portal where they have a pre-interview scoring. So based on audit, research, any publications that you have, any previous experience that you have, any postgraduate qualifications and diplomas that you have, any awards, achievements that you have, everything counts. So everything counts into these bits and pieces, and that actually gives you a pre-interview score. And then you go into the interview. Based on the pre-interview score, you get selected onto the interview, and you go into the interview and you get, say, supposedly, if it's interview gets you some 70% of the total score, 30% will actually come from your pre-interview score. So all these are important. So whatever you do, even if it's actually during your internship or 1 year of experience or a postgraduate training, which you're doing in India, it's always important to document those, create a proper file. And Sridevi is actually working on a system by which you can actually do an e-portfolio known as Med Logbook. So she's actually working on it. You can do that online. Whatever you do as a part of your experience can be actually documented into it. So that's very important, that what you do in your undergraduate period as well as the postgraduate period has to be going into a record, rather than you completely lose it and starting from a point that starting from the scratch and starting to build up slowly. So all these are counting, including your audits, researches, any awards and achievements, publications. It's better to get 1 or 2 publications. Even if it's a case report, it's still okay. Do one case report and an original article when you're doing your internship. It can actually help. Publications are very important. Even if you're not research inclined, you can still do some publications. You can do some case reports. There are plenty of cases which can be published. So I would strongly encourage you to do that once you're doing your internship, or even before that, actually. Yeah.
Thanks for that, Ashif.
For PLAB exam, you don't need a CV, actually. You don't need a CV for PLAB.
Though I would say, yeah, I would say they don't like big gaps in your experience when you're applying for a job, isn't it? They don't like it that you're sitting at home for a year. Then they will ask you to do stuff like observership, and you have to. It makes things more difficult.
It's always better to show your CV, fill in your CV in such a way that you do something every year rather than having a long in your CV. And they also like you to have some inclination towards the specialty you're working towards.
Yeah.
Supposedly you're working for 5 years, suppose in ENT, and you're going for a medicine interview. That counts as the negative point. So you're supposed to be going to ENT rather than coming to medicine. So why did you come over to medicine? The same way, somebody is working in nephrology who's going to take up cardiology. So 5 years in nephrology, that person should be taking up nephrology rather than going to cardiology. The same thing is applicable into your research and what we have done through the career. But you can always change your inclination. It's not that you cannot, but as long as you have some sort of an inclination, it's always better to stick to that interest before you start applying for specialist pathways.
Yeah. So what are the courses that we can do that are beneficial? I'm assuming that this refers to before you do PLAB. So there is a course called PLABable and another one called Med Revision, which there are others called Pass Test. There are a lot of options there. Now, what one of the candidates I've not written PLAB ever, I've not attempted it, but one of the candidates, I had a chat with her very recently as last week. And what she suggested is you register for 2. Like PLABable is like a capsule course, while Med Revision is a much more theory rich course. So if you do the course in one and you do the mock exams in the other, you're covering everything. So this is, I think, a very good suggestion, because sometimes there is a lot of questions in one program which are not in another. and they content. So this sounds like a very good suggestion to me. This is, I think, you do have separate courses for MRCP. One that I have never found a course for is MRCS ENT. I am an ENT surgeon. I couldn't find one. I had to sort of teach myself and go online.
Courses for MRCP. Yeah. I'll add on from there actually. For MRCP, I strongly recommend you, if you're planning to come over to the UK and if you have 1 year of experience, it's always better to do MRCP rather than PLAB. The reason for that is MRCP is a postgraduate diploma. You get an additional diploma on top of PLAB is not a diploma. It's not a qualification. It's just a licensing exam. But MRCP is a diploma. So if you're planning to come over here after 1 year of experience or after your MBBS and qualification, it is better to do MRCP. Because once you do MRCP, you get your qualification. You can, even if you don't get into the pathway, you still have a postgraduate qualification, which is still a good qualification recognized throughout the world. But for that, for MRCP, there are part 1, part 2, and PACES, as I briefly mentioned. Part 1, you can do MCQ. Part 2, it's MCQ, and there are websites like Past Tests and Past Medicine. There are a lot of websites actually which gives a huge amount of resources and questions and question banks. So it's better to go through all that before you go for the exam. You easily clear part 1 and part 2, but PACES exam, the practical exam, is a little bit difficult to crack because it's just a 1.5 hours exam, and there's also a luck factor involved. So you have to prepare very well. You have to be very prompt, used to seeing patients, making diagnosis, having communications with the examiner. There'll be actually proper patients sitting in front of you. So you have to deal with patients properly. And I'm sure most of us being trained in tertiary medical college will have that skill in dealing with the patients and communicating. This difference between the way we do that in India and we do that in the UK is that we are communication intense. In India, in UK, US, and Canada, we have to talk to patients. And we have to talk to patients in such a way that we're convincing enough, and they have to understand in very simple words so that it's not complicated at all. Take consent for each and every step in your examination. So everything is important. So for that, you have to get trained. Even if you're doing your proper, clinical examination skills and everything is good, if you're doing that in India, that all counts. And on top of that, you have to work on your communication skills. So my recommendation is, if you're planning to come over for internal medicine training program, it is always better to do MRCP rather than PACES. And mind you, if you have MRCP and if you register with GMC, you can only do internal medicine and internal medicine related specialties. You cannot take up surgical specialties if you come here with MRCP alternate pathway for registration with GMC. You cannot do a surgical specialty. It has to be internal medicine. Yep, go ahead.
Yeah, the closest I can think to PLAB is you finish your MBBS, you finish your internship, and you register. So that is the point you are at when you finish PLAB. While MRCP and MRCS, it's always an extra point on your CV when you do it. So I'll go to the next one. When should I start preparing? I think we've already covered that. Is trying for it better than trying in India? It's a tough. It depends on what your priority is, isn't it? I did my PG in Maulana Azad and I have no regrets. It was excellent. It was really good. Exhausting, and I think it gave me post-traumatic stress, but still very, very good.
Yeah, I did my postgraduate qualification, and so I did my MD in Calicut Medical College. So we are equal in that way, actually. The number of cases we have seen, I don't regret at all. And my teachers and my professors and the level of knowledge that I gained from Calicut Medical College is immense. So I don't regret. So it was so easy peasy coming over to the UK in practice, but clinical skills were fine, really fine-tuned. There was no concerns because I've done my MD in India, but communication skills had to be improved. Even for, that's the way it is, because we see bulk of patients in India, but communication is lacking in different domains. So that needs to be improved. That you can work on it, and it usually takes only a month or two for you to improve, and it will be an ongoing process. Yeah.
I think another thing we are lacking is documentation. in India. I remember how I used to make notes as even a senior doctor, and it's nothing like how I make notes now. It's just that you know what is going on in India now. There's a lot of violence against doctors, which is really sad to see. I think when we did our MBBS, people were really respectful, and I mean, obviously, I mean, you shouldn't. People don't like us saying it, but being a doctor is a job. And at the end of the day, you go home. Yes. And you shouldn't get beaten up for doing your job, even though it sometimes involves your patients dying in the end. Sometimes people are so sick that they do die. And that is not acceptable, apparently. I do find it very strange. But I think if you document what you have seen and your documentation is spot on, you may not remember this patient 10 years down the line, but if it comes to court, your documents are still there, and that will help you remember what actually happened in that situation. I don't remember what I did last week. When you see a number of patients, it's hard to keep track of what happened with each patient. So because that's also addressing a question about violence, and we'll come to that.
That's also a cultural shock for you when you come to the UK, actually, because you have to document each and every point you do. And it's very important. Documentation is very important when you see a patient. It's a key to protect you, not only to protect you, it's also important for you to remember what you did before. So when you see a patient in a clinic, when you see a patient on the ward, it has to be documented perfectly onto the notes. Yeah.
Okay, so going to in the gist of it is, doing your PG in India is a good thing, but you have to be careful, because there are some colleges which are, especially in North India, I find there are certain colleges where training is not exactly what you would expect it to be. Even in Delhi, where I did my PG, there were differences between the various medical colleges. I mean, I was quite fortunate to end up in Maulana Azad. I didn't know where I was going when I selected that place, but it was an amazing place to work. And I have some very
I need to add on bit. Like training in India, do you want to do the full training in India before you come over to the UK to practice? But that is really questionable, actually. So if you're planning to do a training in India, like in internal medicine, you can do an MD if you want. That will still be counted for those 3 years that you do. You can help that to be counted towards your core medical training when you come over to the UK by getting that recognized. But beyond that, if you go to a DM and you finish your DM training in completion, you become a consultant and subspecialist. When you come over, it is not worthwhile getting into that subspecialty training again, because you're going through the same process again. At that point, the best pathway would be getting a certificate of CESR, or Certificate of Eligibility for Specialist Register. That's something you can read through. It's much more complicated. I'm not going into those aspects here, but there are 2 ways you can deal with it. If you're planning to come out and do your full training in the UK or US, you can come over right after your MBBS and do that, because you don't have to spend those 3 years in India doing your postgraduate training. But if you decide to come over, if you decide, okay, I have to stay here, get some experience from India, you can do 3 years of postgraduate training and come over to the UK and get those 3 years recognized. And then you can actually do your higher specialty training. Mind you, higher specialty training in India, in the UK is 5 years. So it's much prolonged. The total training duration in the UK is much prolonged, much longer compared to Canada or US. So it's longer. So you have to be prepared for that.
Yeah. How practical is it to achieve? I think you're going to talk about PLAB. So the pass percentages, it's percentile, I understand. Percentile, so there's no cutoff mark, but the pass percentage is around 68 to 72%. So you have a very good chance of getting through. I think 68 to 72% is very good. And I know how hard our students train. So I think it'll be a piece of cake. Yeah.
PLAB is an easy exam to crack.
Yeah, that's what our general feeling is. Is PLAB necessary for all European countries? I'm afraid I don't have a clue. I don't think their licensing, to some extent, being registered in UK, I think gives you certain rights to work in certain European countries. I don't want to comment on something I don't know a lot about. Okay. And also I got a question about other European countries. I'm afraid I don't have a lot of experience, but generally all these places have their own language, and you will have to go through the language assessment. You'll have to have a language proficiency. So I don't know about you guys. Some of you are very good at languages, but my language is very bad. So asking me to, I mean, I'm in Wales. A lot of people speak Welsh. I've been here for 5 years. I'm still struggling with basics. So I wouldn't fancy going through a language proficiency exam. And remember, these places expect you to speak to patients in German or French, or in Austria, I think they have their own language, Switzerland. So I'm not very sure about the process. Generally, I find they all have a medical board. If you Google it, you'll find it. And you can write them a letter asking the question. I am an MBBS. I've done my training here. What is the pathway for me to practice there? If you ask this question to them, invariably they respond, isn't it, Ashif? I mean, they might take some time, but they respond. They're very, and they're efficient about it. Do you want to add something?
I don't think PLAB is recognized outside the UK. PLAB is just a UK licensing exam, isn't it? So
Yeah.
I don't think European Union recognizes that. Once you get your training in one of the European countries, you can actually ask for a training recognition in other European countries. But the problem is language. You need to have language to practice. So I don't know. PLAB is definitely not recognized.
It's not for me, definitely. So what are the opportunities after clearing the exam? For MBBS, after MBBS, you can go for something called an SHO post, I think, a senior house officer, which is like you have a little bit of experience, you have done your internship, and you're going for a junior level job. I think it is ideal if after doing your MBBS, it will give you that chance to collect all those things you need for your interview. Like, suppose you have decided, I want to be a surgeon. So work in general surgery as an SHO, do an audit with your senior, collect, there is something called a CREST certificate. Now, if you have done a lot of work in the department, they will sign off all those things. It just means that you're equivalent to someone there who's working there, and you are good enough to go for training, apply for training, basically. Yeah. Whether it is general practice. Now, general practice is a very good option. I realized once I came here, it's like family medicine back at home. If suppose you want to see a neurologist here, you have to go through the general practice pathway. You have to go to your GP. They have to refer you. So they are like the gate, and you have to get through that gate if you have to go to your specialist. Isn't it, Ashif?
Yeah, that's true. Actually, general practitioners are specialists here. When GP is not MBBS person, he actually goes through a F1, F2, which is foundation year 1, foundation year 2. Foundation year 1 is like internship. F2 is like SHO, senior house officer. And then they have to go through GP training program, year 1, year 2, and year 3. So it's a 5-year training after your MBBS to actually get into a GP. So at least 4 years training. So it is actually...
It's 3 now, but I think they're changing, but okay.
Are they changing it now? Okay. So it becomes, so that is, they call it a family medicine specialist. So they are actually specialists, GPs.
Yeah. So let me go to the, I'm just going to ask the moderators, are we okay to just go ahead? Or do you need
have any specific questions, other than the ones which you have written down for us?
We can continue with the questions, but if you need us to stop, just let us know.
Ma'am, there was one question in the chat box.
Yeah. Oh, yes.
The question was, by 1 year experience, does it mean 1 year house urgency or first year of junior residency for MRCP exam?
Okay, 1 year junior residency. It's internship is internship. What Ashif just mentioned, FY1, foundation year 1. Yeah. after you finish your theory and everything, you have to have 1 year experience. Sometimes people do 2. I mean, you have to do 2, sorry, FY2 as well before you apply for training. But what he means for MRCP is 1 year post internship, like junior residency. Yeah. So do you want us to continue, or do you want us to stop? I mean, there are a lot of questions.
No, ma'am, we can continue.
Is that all right? Okay.
Yes,
ma'am. So I already talked about percentile. Now I'm going to talk a little bit more about GP, just a little bit, because I would like to know about the process in detail of GP. Now, I am 42 years old. I just wrote my GP exam twice because I just wanted to know what it is. I did not study for more than 2 weeks for the first time and hardly for 3 days for the second one. I got through both of the exams. It wasn't that hard. So, I mean, if you can write NEET, which is really a hard exam, I think GP is just like a walk in the park for you. And remember, I'm not in the habit of writing exams anymore. So it's just a...
GP training pathway.
Yeah. So what the way of getting there is, you come here, you work for maybe at least a year. Before you go for a job, you tell them, I want my CREST certificate signed because I plan to apply for training. You need to be very clear in the interview about what your goals are. And once you get that signed by one of your consultants, you can apply for what is called an MSRA. MSRA is the exam. It is an exam not just for GP, but for, let me just see, psychiatry, radiology, ophthalmology, OBS and gynae, sexual and reproductive health, and neurosurgery, a lot of exams. So it is a common exam for all of this. In the others, you need other things as well for your interview, like you need an audit, you need to do maybe a paper, teaching activities to just show your profile. It's called making a portfolio. But this is basically it. You get matched to a GP post and then you take it from there. Yeah, that is how usually GP works. Do you have anything to add, Ashif?
No, I was talking about the prospects of the GP training program. So if you do a GP program from the UK, it is easy to recognize your program anywhere in the world. It's so easy in the sense that GP is in a huge demand in Canada, in Australia, everywhere actually. So if you finish your training in the UK, GP is the pathway where you actually get into Canadian system even without a single exam. You can actually have a CCT. They call it CCT GP. You finish your training. Once you have that CCT in GP, you can apply to Canada if you prefer to practice in Canada or Australia, and you can actually go there and practice. And after 1 year, even without exams, you will be given a recognition by a simple assessment from the College of Family Physicians in here or equivalent college in Australia. That's what my understanding is. Things may differ a little bit here and there, but it's much easier than a specialist pathway to get recognized. GP has a huge demand. Number of GPs are actually quite less in different parts of the world.
Even with GP, if suppose you want to specialize in something specific, like you have a special interest, dermatology, or in my case, I have a lot of experience in ENT, you can do that as well. So you can say, I have special interest in ENT, and I'm going to do a lot of ENT in my practice. So even that is doable. I'm going to the next question. So I'll just very quickly, so that in case we are short of time. Let's see, where were we? What are the prerequisites required to be done earlier in the process, or whatever you call it? And you can actually message me. I will try to answer the questions. Okay.
Are there any questions for me, Sridevi, in that?
I think nobody's answered a question except Raj. Thank you for that, Raj. Either we are doing a very horrible job, or
do you have any questions? the audiences, do you have any specific participants who are in here? Do you have any specific questions? You can actually unmute and ask if you want. You're more than welcome to. I know we have a set of questions which is written down for us, but if you have any specific questions which you think about, I mean, we've gone through a lot. I mean, there is a huge amount of information which we have shared with you. It's not that easy to comprehend, but basically it's just, we can share our slides and everything, and those links which are there in the slides, you can actually go through that at your ease when you're free. But if you have any specific questions, just please unmute. It can be a very informal discussion.
I think we have a very limited number of people here. And
there's 27 people out here, even if you ask.
Yeah,
okay,
so it's possible to make this more informal thing, if you'd like, and make it a more of a discussion than
any burning questions, anything that you actually figured out, or any doubts that you have. Just make it like a classroom, so you can actually bring up with your question.
So the next one, I'll just keep going. You can either put your hand up or unmute and ask. Just think of it as a discussion between friends. Understand that hierarchy is nothing like it is in India, in UK or Canada. I remember walking down the corridor, and my clinical lead, or the most senior person in my department, his name is Mr. All the surgeons are called, very ironically, Mr. And the doctors are, the physicians are called doctors here for some strange reason. So the porter was calling him Phil. His name is Mr. Phil Moore, but they are on first name basis. In fact, even nickname basis. Have you noticed, Ashif? So you will find
so that system is not there in Canada for that matter. So we call everybody doctors. So we don't call surgeons Misters, actually. Yeah.
Oh, that's good.
True. I worked in Cambridge with very leading researchers. We used to have a very top level sort of consultant researcher, Steve O'Reilly, and he's Sir Professor Steve O'Reilly. We just called him Steve. So, or Professor Krishna Chatterjee, we used to call him Krish. So that's the way it is. You just have to, that's one thing you change. I told you about cultural shock when you move over to a different country to practice. This is one of the cultural shocks which we had, that we mutually respect each other, but then call each other by names. And, if you have any questions, you're always free to ask. That is something which is very different from maybe in Indian system is also changing, actually. It's much different from what it used to be years ago. We are much more friendlier with our teachers nowadays. But our professors used to be wonderful in India, but that's a different story. I'm not going into that. They're so experienced, great, but we always had a gap. So that was there.
Yes, you don't address them by, you're even very careful when you look at them, and you maintain that respectful distance. I used to call my second year PG sir. That's the hierarchy. The only people you call sir in this country is if you've been knighted by the Queen, isn't it? That is the only reason why someone gets called sir. You call them doctor at best, or usually first names. So you can ask a question if you have one. What is the difference between USMLE and PLAB? They are totally different. I think PLAB, I think, is an easier exam. USMLE requires a lot more. I think you have to think about it. I think Sunita is going to cover USMLE, but they are very different exams. Okay. Ardis, Ashif, do you have any experience? I think Kaplan's is the best.
I haven't done any parts of the USMLE, so that's something which I think you should join that talk. It's important because USMLE is one of the most realistic exams which you can write now at this current clinical scenario. You can actually go through USMLE exams and finish your training in the US. And if you want, you can choose to practice elsewhere in the world, or you can decide to come over to the UK and practice. USMLE is one of those exams which are much easier nowadays because it's more access to the exam. It's easier to write, easier to go through, but there's always a pathway and a waiting time. So I haven't written the exam in person, but yeah, it is a good choice for people who are planning to take up training program right after MBBS. So yeah. If somebody's planning to move right after MBBS, USMLE is the best choice.
Yeah, I think I find that a lot of my when I was doing my post-graduation, there were about 30% of the students, the interns, I mean, they had already done a clerkship. They had done a project. They were all mentally preparing for USMLE. And this was in 2007, a long time ago. So they have a system they have seniors there who advise the next generation. And they have a generation of people, doctors going there from MMC. So I don't know if we have the culture has changed, but we didn't have that when we were in Thrissur Medical College. I think the only thing we could think about is cracking the PG at that point. So
we didn't have a NEET exam. At that time, we had a Kerala postgraduate entrance exam. So we didn't have a NEET exam at the time. So we were thinking about NEET. So Kerala entrance and all India entrance. So those were the type of entrance exams we had into the postgraduate training. So we were more focused on that because our information, as I said, is the key for you to get into different pathways and to decide in advance what you're planning to do. So you need to know what are the pathways you have in front of you right after your MBBS to get into that pathway.
Yeah. For USM, no, when should I start preparing? I'm going to skip that. What can we do to ensure safe working conditions in India? I think I covered a few things. Document what you do, document what you say, discuss with your senior if you are not sure. Always, I think, include another doctor or ask for an extra opinion. Don't be egoistic about it. You don't have to do things on your own. The other thing is keep records of what you're doing. What I found, my husband was a meticulous recorder. He used to keep track of all his procedures, not his case presentations or anything, but at least his procedures. He's a gastroenterologist. And what you find is all these things are important. I recently was reading about a case, and the judge asked, what can you do to prove your experience? Now, in India, you document nothing. So the doctor obviously had nothing. You can't just make records for the past 20 years out of the air. So it is a good idea to keep track of what you're doing. Otherwise, you can say, I have done 500 procedures. This is my experience. Obviously, I'm qualified to do this particular procedure. I think that is important. And also get a professional protection scheme. As soon as you finish your MBBS, you are not protected even as a postgraduate, which is what I've found. I personally know someone who had to go through a court case because he followed his senior's orders. So I think getting a professional protection scheme and getting a membership with the, Hashif, I'm sorry, it's so late in your place, no?
No, it's okay. It's okay.
You
go ahead. You go ahead. It's fine.
Yeah. I think the professional protection scheme by the Indian Medical Association is a good idea. They have their own lawyer. So if you get into trouble, you should be able to ask someone for legal advice. It's a good idea anyway. Do you have anything to add?
I think there is a correction to what we mentioned there with MRCP Part 1 exam.
Okay.
There's a mention that this is from MRCP UK website. So entry requirements for MRCP UK exam. Part 1 exam, candidates for MRCP Part 1 must have at least 12 months experience in the medical employment by the date of the examination. That is, must have completed Foundation Year 1 or equivalent. Candidates will therefore not be admitted to MRCP UK Part 1 exam until 12 months of the date of graduation given on their diploma of medical qualification. So the date of graduation on our diploma medical qualification is the date of our exam, isn't it? It's not the date of the completion of internship. So based on what they have mentioned, so Part 1, so in your diploma, if it's this particular year, so right after that 1 year of experience is what you need to apply for the Part 1 exam. So yeah,
you mean lab or MRCP?
So it will be good to MRCP.
That's correction. It wasn't that way.
Yeah, that's a correction.
Yeah.
So I had a confusion about that. So yeah.
So they can practically write it immediately after their MBBS.
After their internship.
Yeah, internship.
internship.
Yeah, so there are a couple of questions. I think we'll just very quickly address it. Ma'am, clearing PLAB 1 and 2 right after internship, what should be done next to enter residency program? Okay, so you have to first decide, am I going to do medicine or surgery? So if you are medicine, there is the the 3-year core trainee. It's the new name, no, it's rebranded now. So you have to do 3 years in a medical specialty. I think it's called IMT or IMG. IMT, yes. So internal medical training for 3 years, endocrinology. Is that right? Yes.
Yeah. So there used to be a pathway known as core medical training and higher specialty training. Core medical training used to be 2 years, and higher specialty training used to be 5 years. But now, if you want to do a complete internal medicine and endocrinology, or internal medicine and nephrology, or cardiology, you still have to do those 7 years. Maybe you have to do some additional qualifications to get your interventions like cardiology there. I mean, after that, so 8 years program. So it takes 8 years after your F2, which is 1 more year of your internship, and 1 more year, which is your SHO, and then 7 years of training in the UK. So there is a question about, is there a...
Can I just interrupt? I'm just going to talk about the surgical stream, and then you can... So with surgery, you have core surgical, which is, I think, 2 years, and then you can apply for the specialty. It is doable. I know lots of people who have done it. So you should actually do your initial job as a surgical specialty. The way of doing it is, once you have done your General Medical Council registration, start applying for jobs. There is a website called, I'm just going to type it here in the for everyone. It's called Track Jobs, track.jobs. That is where all the jobs come. Alternatively, you can go through some of the agencies. You don't have to pay the agency. The board pays the agency to find you for them. So you won't have any cost in contacting the agency. It is up to them to find you a job. And
is there no NHS jobs anymore? NHS jobs.
That's transition to track jobs now. Yeah, there is still NHS jobs, but they are transitioning. So I think go straight to track jobs and apply for jobs. What you're searching for is, I think, junior clinical fellow or clinical fellow jobs. I don't think they do SHO. They post it as senior house officers, or I think registrar jobs. You can apply if you have a little bit of experience. Look at the specialty, and you can see what jobs are available, and you apply. And you will eventually get called for an interview if you're GMC registered. Before your interview, you can give us a call and we will help you prepare for it. Yeah. So
there's a question now. So I think I should direct that to you. So there's a cost of living crisis in the UK.
Yes.
That the strikes and the pay disputes that junior doctors have with the NHS. So my question is whether the pay as a junior doctor good enough to live in the UK.
Well, when I came, I don't mind disclosing this. When I came to the NHS, I got my initial pay was a bit low. It was, I think, around 43,000 pounds, which is like, it comes up to about 2,800 pounds at hand, which is quite a low salary for me and my family. But if you are coming as a junior doctor, you're going to just probably go for a single accommodation, and you don't have the cost of putting your child in childcare. So I think you can very easily, lots of people do. I find not too many Indians coming, more of Bangladeshis and Pakistanis coming, and they manage fine. I recently had an SHO in my department. She managed fine, and she got into GP training within 1 year of coming. My consultant signed everything off for her, and she's in her 2nd year now. So while we are just doing this job, she will be a consultant GP in another 2 years' time. So they are all like maybe she is 2 or 3 years older than you guys, by the way. Yeah.
and I never had this problem before. This is all cost of living crisis and everything came up after COVID, isn't it? So
yeah, but life goes
I
on.
never
I
had,
mean,
I never had a problem with, so it's
uh,
just fine actually. It was much
there
easier.
are strikes, yes, and they are trying to get better pay. But remember that you have fixed hours. 5 o'clock, a lot of people, you're gone. You hand over to the next team and you go. You get enough time. Nobody calls you after 5 unless, and they are very respectful when they do. When you work extra hours, you get paid, and you should tell them, I want to pay paid locum, which is usually, I think, 2 or 3 times what your normal hourly rate is. And if you think you are
Maybe
not
slightly
earning
more
enough,
than that.
pick up yes, slightly more than that. And if you don't feel you're earning enough, pick up a couple of extra shifts, I think, and that will pay enough. It does. I didn't have any problems managing. Yes, it is
Moving outside the
expensive.
country is, moving outside the country is always moving out of your comfort zone. So that is something you should always remember. So if you don't want to move out of your comfort zone, then it is better to be in India. Because once you move out of the comfort zone, and if you find that not getting enough pay, or able to meet that standards of living, because each and every one of us are different. So if you have a really good standard of living in India, even then we decided to move. Our standard of living is not too bad. So the reason for that was to get more qualifications and training. But now things are a lot different. India is also advancing as a nation. We're proud that India is actually picking up and advancing as a nation. But for doctors, I think we are still backwards, in the sense we are not, it's not as good as we expect. That's what my understanding is actually. So you still have to get your qualifications, whether the qualifications is in India or outside. Staying with MBBS and deciding to practice with MBBS is not something that is advisable. It's not that you cannot do it, you can of course do it. But at this current scenario, there were people from our batch who decided to do their practice after MBBS. Take it from me. So there were many, at least a few, who decided to practice for a few years before they got into a postgraduate program. But now the things are so different that you need something to actually progress through your career rather than getting stuck at that level. So you have to choose between India or going outside to get your qualification. So you're always coming out of your comfort zone. So there's always a problem there. Payment can be different. The way you live is different. It can be a cramped accommodation where you're into. If you're living alone, then there are things you can actually compromise. But yeah, it's all up to our mindset about what we are planning to do, basically.
Yeah, I think everybody has their own personal reasons for moving. One of mine was I had a patient who got quite aggressive with me. I was not happy risking my life for doing my job. So each of us have a different reason. My husband wanted to travel. And when you're a gastroenterologist in India, even as a consultant, you're working all hours. I found that he had no, if you call it work-life balance, he had work and no life. So, and he was not having time with the kids. So these are the reasons. So if you have a similar reason, maybe you want to move. Otherwise, you want to stay close to family. Yeah.
So there was a question about racism in our.
Yes. Yes.
Do you want to say something about it to start with, or should I just add a few points?
I don't know if it's Wales, but people are so nice. And so, yeah, I have no complaints about racism so far. I find people on the England side are a little more stiff, but I find they're not racist.
I really do feel that. I mean, it's there, right? Always. I mean, there are differences in people, and it is the way you take it, actually. That is what I feel. I mean, you may not like them and they may not like you based on the way, maybe your color, your appearance, but that's all there. I mean, if you look back in India, there can be differences based on caste, religion. I mean, I'm not going into that aspect there. So the same thing is applicable when you come out of the country. So they are seeing a different kind of person. So it's a different kind of a human being. So there may be a few people who actually think differently and talk differently. So you are a doctor, and the way you communicate and the way you deal with them has to be professional. So I always felt very comfortable in all my practice environments. This is something which I always tell everybody. In Cambridge, there used to be white dominant people. So all my patients were white, a white dominant community, but they were well educated. I mean, in east of England, when I was going through the rotations before I came into Addenbrooke's, which is Cambridge, before that, I had district hospital where I rotated through, there used to be white dominant community. I never experienced even a single experience of really bad sort of approach from them. And most of them are really grateful for what you're doing. They were grateful for you coming over and treating them. They're grateful for you filling in the gaps in NHS and helping them out. That is what my experience is. I mean, I'm not saying everybody is good. There is always 1 to 2% of the population who take it differently. They do have racism, but that is there in every part of the world. You cannot remove racism from your work environment forever. I mean, it is there. So you just have to approach it properly, professionally.
I mean, we have a face cream called Fair and Lovely. I mean, what can I say? I mean, let's not talk about, groupism and racism. I mean, it's there everywhere, even in India.
But, I touched upon that point only because it was there on our list of questions to answer.
I agree completely. I mean, I think people are very respectful. And as doctors, you have situations where you have to step out of your clinic and go, and a very elderly patient, 80 years old, is waiting for 2 hours just to see you. They've been waiting for this appointment for 2 years. And you walk out of clinic, they're not going to say a thing. They are just going to come in and see you and go. They won't be disrespectful. And I don't think we will see that in India. Generally, I mean, they're not going to be happy with you walking off after they've waited a long time to see you. Waiting lists here are crazy, and people are generally respectful. Okay. And I mean, we are looking different. So people will perceive you differently, obviously, and we perceive them differently as well. So,
but now things are changing. So our community is there in the UK.
I know.
Big number. It is not like 10 or 20 years ago when the numbers were very minimum, actually. So now in every department, we are there. I mean, we are always there.
So I've got just 1 or 2 more, which I will cover. How to know which specialty to choose after MBBS. Do you want to a medical or surgical specialty is something you have to make a decision. You have to decide whether you want a clinical or a non-clinical or a paraclinical specialty, or do you want to just get rid of MBBS completely and do something else? A lot of people do that because they feel they are not suited for the career. I think I mean, Ashif mentioned my project. I'm considering a little bit of, trying something different. And I think UK gave me the time and opportunity to do that because I see other people doing that, other people indulging in other interests. I'm sure every single person in this room are very talented individuals who have other talents beyond being a doctor. So, I mean, that's entirely up to you. But I think in your head, you have to decide, do I want clinical or non-clinical? I mean, paraclinical. And if I want clinical, do I want surgical or medical? And then if you have an interest, like I liked ENT more than general surgery. I thought of taking general surgery, gave my husband almost, because it's quite it's a hard profession, general surgery, I feel. And then you have to specialize. But I finally decided on ENT, and I'm quite happy with ENT. I think Ashif must have similar reasons. I think our batch was quite medicine strong, and everyone loved medicine, even me. And I think we have a lot of physicians, unusual number of physicians and psychiatrists in our batch. Yeah. So it's up. I think you have to have that.
I think it's already time. Should we?
Yeah. I totally agree. Yeah, I'm going to just take 1 more minute, if that's all right with everyone, to just talk about a project I'm on. So Ashif is also involved. We've made an online medlog, an online logbook. So one instance I have is when I came into this country, I've done a lot of tracheostomies. And there was this patient who needed a tracheostomy change. You all know what a tracheostomy is. So I was I was called to theater and my consultant wasn't there. I said, I'll do it. That's not a big deal. I've done so many. And the anesthetist was like, oh, she's a new guy. I mean, I don't know what she knows. And I said, I've done around 400 in my training. And they all looked at me like I was saying I'm alien from Mars. Because, I mean, they don't believe your numbers because I didn't have any evidence as well, or you don't keep logbooks in India. So, but that evidence is important coming here. I understand firsthand because my husband tried, when you become you want to become a consultant here, you have to bring evidence. And he brought evidence from India. He's very different from me. He's got records of everything. And GMC has accepted a lot of it because he's in the habit of keeping records in the right way. So we have devised a logbook for people who are interested in coming here, who want to get everything electronically signed off from their consultants to make it easy. So it's a free logbook at the moment, and I would like at least those of you who want to come abroad to give it a go. I mean, we go paperless with everything else. It's so strange that we are still with paper logbooks in India. So I just wanted to just say that. I'm going to leave my Instagram login in there. If you have any questions, I have put a lot of links in my bio, which might be useful. So I think we will stop here. I hope we haven't put everyone to sleep. So, yeah.
Sridevi, this is Dr. Binu.
Oh, hi, Binu, sir. So I also wanted to say thank you, Binu, sir. He is the one who started this entire thing.
Actually, I wanted to ask you a person, like, if you're planning to take any surgical specialty as your career, would you advise a fresher to like come to the UK immediately after MBBS, or what do you prefer, like doing an MS in India and then coming over, and what are the difficulties that you might face if you
okay, in retrospect, there are people who have gone into training at 40 and 50. I personally know them, but it is really hard. So if I had known what I know now, I would have borrowed some money to write my exams. After my MBBS, I would have come here, done some years in it's called core surgical training, where you work in a surgical department. I would have gotten a couple of audits done, gotten my logbooks in place, and I would have applied for surgical training here. It sounds long, like when you think 8 years, 7 years, oh my God. But you have to understand that the UK government and European Union rules don't allow you to work more than a certain amount of time. And trainees are really pampered here because if the trainee is not happy, they can give a feedback and the deanery can take away the funding for the training. So they are very important people here in UK. So in retrospect, if I had known, not that I have any regrets about studying in Maulana Azad, it was brilliant, but I find jobs a little more difficult to find nowadays in India. And that's my personal feeling as an ENT. It might be different, but I would have definitely come to UK. If someone, I think you need people to advise you about the right way to do things. And I don't think we had a lot of people who knew what to do, isn't it, Ashif?
Yeah, that's true. I mean, surgical specialties are difficult to get into in the UK, and not only in the UK, in the US or in Canada. Surgical specialties are much more sought after than medical specialties. That is some sort of a difference compared to what we have in Kerala. So in Kerala, we choose both specialties equally, isn't it? But here, surgical specialties need a huge amount of CV data. You have to be exceptionally wonderful in getting into the pathway. So there's a huge number of people who will be waiting on the waiting list. So if you're already here and if you have your core surgical training, and then you have your permanent residency by the time you apply for your higher specialty training, then that will be an add-on point. Because if you don't have that permanent residency, most of our students are so good. When they come over, medically, they're wonderful. This residency to get into a higher specialty training pathway in surgical specialties. So it's always better to come over here and do the core medical training, get experience, get the permanent residency. And even without residency, you can still get into, because you have that many years of experience in the UK, so you can crack the interview easily. But medical specialties are easier to get into. Almost all the medical specialties are easier, and because the number of seats are higher, and it's easier to get into. So you can always do a postgraduate qualification from India if you want to come over. But even then, it's always better if you're planning to come out and do a core medical or an internal medicine training in the UK and finish your higher specialty training. So, or do a USMLE and do a residency if there's a plan for coming outside India. If not, it is better to do specialty training from India and practice in India.
I think I personally know people who have gotten into surgical training. It can be done. It's just you need to do it in the right way, and you need to expect that as soon as, it's not like PG in India where, oh my God, I haven't got PG in 2 years. What's going to happen? It's some people prefer to just work for a little while before they get into training. A lot of people don't ever go into training because they like the sort of job work-life balance they have. Or the sort of work they are doing in the department in a junior level. So I know career senior house surgeon, house officers who've done no training. They've just started working from MBBS and they make very good money. They have good work-life balance, and they have other interests. So, but if you want general surgery or surgical training, it can be done. You just have to, but make your CV look good and get into the habit of, sort of whatever you do. In fact, every single thing you do is a skill, and you have to get into the habit of documenting it and bring it here.
What about the hands-on experience? When this is something which I don't know. There are
lots of people ask me that.
Hands-on experience in the UK versus India. I mean, how is that?
So for me, I have 3 theaters, which means 1.5 days. I've obviously trained in India, but I started operating in my 2nd week or 3rd week. And now my consultant says, okay, Shri, it's your list, you do, I'm going, and he goes. But we do similar numbers. Our one all-day list has 6 to 7 patients, which can be a variety of, in India, generally ENT means tonsils, adenoids, tympanoplasties, mastoids. We do all that here. In a bigger center, you will do head and neck. In one of the other hospitals, we do implants. So suppose I am interested in those things, I can tell my manager, I want to learn implants, and they will send me there. I will find someone who's doing implants, and they will let me assist and eventually do it myself. So you can operate. I mean, lots of people do. In fact, we don't have enough people to operate, basically, to do lists. So that's the situation.
Even so, the medical training, there is no lack of cases. I mean, because NHS works as a government medical college in the UK. So most of the difficult, tough cases, you see everything. Actually, it's not that difficult to see any number of tough cases in the UK as well. May not be as advanced as we see in India. You don't see a really advanced case where you see huge liver, spleen every day, but you still tend to see medical cases, really challenging medical cases throughout.
Yeah.
So, yeah.
Hello, ma'am.
Yeah, hi Raj, go on.
Ma'am, I'm Richard. So I'm a 3rd year student.
I'm sorry. You're Raj on your screen, sorry.
Ma'am, currently we are, according to the CBME syllabus, we are currently documenting all our work in our departments with the logbook. So is it actually correct to do in that way with our professor signing it off, or should we do it digitally?
Don't you think it's entirely up to you? Because I mean, I don't know what your curriculum says, but I have looked at the NMC guidelines. They have certain guidelines about your logbook, about how it should be structured. So I think every single place I know, I'm not India, but outside India is an online logbook. I'm not very sure about why we are still having paper logbooks in India. Here we have an e-portfolio. Unfortunately, you won't have access to it because you don't have a General Medical Council number. But I think, I mean, we've made a logbook. It may not be accepted in India, but what I find is a person who's come from India to UK, there is a lot of interest in them. They are the people who are actually using the logbook because they realize they should have collected all this evidence in India, but now they can't go back and collect it. There is another problem with logbooks. Are you keeping your records anonymized? I'm not very sure, but here, if you have a patient number or a name or something which identifies the patient, the GMC will call you out on it. You're not supposed to put any patient identifying details. So when my husband brought his records from India, now these were paper records from SDPGI onwards. This is 2010. He had to redact it. Redacting means blacking out every single name and every single registration number which was there on the records. So you can imagine the amount of work that was. So, I mean, I think if your senior teachers are willing to take it, because it's not difficult. You make a entry. It will take you exactly 2 minutes. And you send it to your teacher. It will take them maybe 1 minute to verify it. Is it harder to do that on a paper logbook? I don't think so. So that's my opinion. That's my personal opinion. I have been an educator as well there. So I think things will change. I don't know if it will change this year or maybe 10 years from now.
Ma'am, according to your talks, your and Ashif's talk, I came to the conclusion that it takes pretty long time to finish all our qualifications. So is it worth it?
That's your take home. Okay, think like this. In India, I'm sorry, it's a bit of, there is a lot of push for you to get into PG, isn't it?
Yes,
Do you, you are already thinking of PG. You're thinking, oh my God, I have to get through NEET and all. Here, there is not as much of a push because you're making enough money to live comfortably as just by doing a junior level job. A lot of, as I said, there are certain people who do only junior level jobs. So if you feel I don't want to go into training right now, that is actually an option here. And Ashif, when did you start your training here?
So I finished my MRCP in 2010. So I finished my MD in 2009, MRCP in 2010. I joined the training program in 2012. I finished my training in 2017. So, but all throughout, I was a specialist registrar in 2012 to 2017, till the end of 2017. And then I became a consultant in 2017. So recognition of your qualifications. I'm sorry if I'm saying this, but this is nothing personal, nothing against our training pathway, recognition in Indian exams. The moment you come out of India, so if you're planning to work in India, it's okay. The very next moment you come out of India, you know that your qualifications are grossly under-recognized. Don't know why, but that is still the case. It is going to be the case for a long time in the future. And the reason for that is we don't have a standardized training pathway. So if you have a CCT, if you have an American board site, you're given 10 more years of training. No, they go through a stringent pathway, just like what you go through, and eventually you get your qualification. And once you have your qualification, you know that this is it. You don't have to gain anything more than that. So you can practice in the Middle East if you want to. I mean, there are a lot of people who are planning to practice in the Middle East. You can get your consultant license in the Middle East just like that by doing an application without doing a single exam. If you want to go to Australia, move to different parts of the world, Singapore, I mean, anywhere in the world, it just opens up
US,
things.
I guess, everywhere else.
Except US. I mean, US used to, I mean, either you have to come to Canada and get FRCPC, or you have to go to the US and finish your US exams. So that is slightly different. And also, even if you're a FRCPC, you still have limited states where you can practice in the US. So US is slightly standing out with that regard. But that is applicable. If somebody is coming from the US to Canada, they still have to do a catch-up thing here. So that those things are always there. So, but you know that once your qualifications are finished, your training is recognized. That is the advantage of doing a training outside. I think that's the main advantage. But if you're
I
planning
think-
to stick to India and if you're planning to stay there, it is better not to do any of these exams. It is better not to come out. Don't waste your time in doing that, because 3 years MD, 3 more years of DM, you finish your training. And if you want to do some fellowship, you can actually do that. That is medicine. Surgical specialties, you do your MS, you can practice as a surgeon. And if you can do some fellowship, you can do a laparoscopic surgeon. You do your ENT for 3 years, you finish your ENT and you can become an ENT surgeon. You can do some fellowships and do some laser. And I don't know about surgical specialties in detail, but you can still do a lot in India after your specialties. And with limited specialty training, that is enough for you to stay there, build up your practice, but you stay there. Don't try to come out. You can come out to the Middle East and work in a junior level. That's always there. So you have an option for coming to the Middle East and work as a specialist, but not as a consultant. Even if you become a consultant, it takes a long time to become a consultant. Most of our Indian qualifications are included under tier 3 in Middle East. I'm talking about Middle East because there are a lot of people who go into Middle East. So tier 3 is a qualification which will never be converted to a consultant qualification. But qualifications from these parts of the world is actually tier 1, where you already recognized as a consultant in that tier. So, and there is something on tier 2, which comes in the middle. When DM qualifications are actually classified as tier 2, MCH is classified as tier 2, where after X number of years and some interviews and some other processes, you can actually work as a consultant. So that is the difference. I think that is the difference.
And
actually.
I think you're paid quite decently. I mean, end of the day, think about this. I'm not trying to panic you, but are you aware of how many medical graduates come out of India every year? I mean, just do a Google search and see. And at the end of, not right now, you're not thinking about it probably right now, but after you finish your specialization, you need to have a good job. And you also need to, I mean, when you're at my stage, you want your children to go to the best schools, you want them to, go to the best universities, and you have to pay for all that. So I would very carefully talk to your seniors and ask about what the job situation is like in India as well. And, what the pay is like after you finish your MS or your DM, before you make any hard decisions, isn't it, Ashif? All those, even though these are practical things, they are very important. And you don't think about it as a student, an MBBS student, because baad ki baat hai, it's going to happen in the future sometime, but it is going to happen. And you have to find a job and you have to support your family, get a house. These are long-term goals for most people.
Yeah, so, most of the training pathways are long, actually quite long. But I think US training pathway is much more, slightly shorter compared to the UK training pathway. That is it. But even then, US training, to get into that pathway takes longer. So if you actually, add everything together, and there is a period of uncertainty where you go through to get into the program. As far as I know, to get into a US training path, after USMLE, and you have to get your matching. But as long as you get into matching and get into a residency program, then it is easy run through, actually. You can finish your residency and finish your fellowship, and you get your qualifications. You can always get back to India if you want to practice in the future. But
yeah, you don't, as a doctor, you make enough money, even as a junior doctor, to live comfortably, I think. Yeah. Especially if you are
even as a junior doctor, you make enough. Yeah, you make money.
Yeah.
Anyway, but staying in India is also not too bad. And for hands-on experience, for hands-on experience, it's great. You get a lot of experience in surgery or surgical specialties. Of course, you get a huge number of experience. Interventional specialties like cardiology and gastro, you get a huge number of patients and experience. So it's not bad at all being in India. But for that matter, you have to choose to start writing needs and just channel yourself, orientate yourself to get into the pathway quicker. And so you decide and do that quicker.
I think I would challenge everyone here to just, I'm junior doctors, obviously, just to think about what do you see yourself 10 years from now? I'm not talking about next year when you get your PG or something, and see how you are going to get there, which is the pathway you would like to choose. Also think about other things you want to do in your life. when you make that decision.
Is it okay if I leave?
Sorry about that, Ashif. Okay, okay. Thank you for coming.
Thank you, everybody for joining, and thanks for.
Yes, sir. So I would like to actually extend our gratitude. First, when we thought of organizing this talk, I actually contacted Dr. Binu sir. He's the one who gave me the contact of Dr. Sridevi, and she was more than eager to help us out. She gave me multiple contacts, and there was a lot of confusion regarding the date. And even after we fixed the date, because of the difference in time zones, it was very difficult to fix on a time. And I'm really, really thankful for both of you for taking time out of your very busy schedules. I know that both of you are very busy, and it's very late in Canada. And really, thank you so much for taking all this effort. This topic was something that almost all of us have had doubts about, and I'm sure that this session helped us a lot. Due to the time constraints, we were not able to address all the questions, but almost all aspects were covered, and I'm really sure that we all benefited from it. Thank you so much, both Ashif sir and Sridevi ma'am, for the really wonderful presentation.
Thank you for this opportunity. We are happy to be contacted by our students if you have a problem. As I mentioned, I put my contact in there. And if anybody has questions you can't ask on this, just send it. I might not answer immediately, but I will try to answer when I can. Okay.
As a matter of fact, going back to the disclaimer which Sridevi mentioned, so we don't work with any recruitment team. This is not a recruitment thing. This is just only because it's Trishul Medical College we actually joined. It's our talent. So,
because it's very close to our heart, isn't it?
So it's close to our heart, exactly. So and you're our juniors, so that's why we joined, to share our thoughts about it. And if you have any questions, it's good that everybody turned up, and there were 34 people to start with, and now there was only 23.
I think we bored them away.
No, we are actually we are actually live streaming it on YouTube. So I think there are more people watching there rather than in the meeting.
Okay. Okay. Take care.
Okay.
Take care, everybody.
So thank you very much, and thank you, Binu sir, for putting us in touch with Kirtana. She's arranged all this, and I think the arrangements have been brilliant. You've done an amazing job. So, all right then. Okay.
Thank you, everybody.
Okay, ma'am. Thank you. Thank you.